okay, my friend.
All right,
okay.
Welcome to Deuk Spine Institute
We're just starting.
live stream.
Relax, everything's good.
It is November 16th, 2023. Our patient is here from Texas, and he's suffering with back pain. He's undergone surgery. Just giving you some numbing medicine, that's all.
Yep, you're doing fine.
He's been suffering with back pain for
We're starting now, okay?
15 months. All right, it's gotten really bad in the last 15 months.
Happened after he had his micro.
Yeah, he had a microdiscectomy done. You're okay, we're just giving you numbing medicine. Where was his microdiscectomy done?
Texas.
At Texas? So he had a microdiscectomy done in Texas, and he has horrible pain afterwards as a result. You can see the incision from the microdiscectomy here. Now on MRI, he's got 2 bad discs in this area, L4-5, L5-S1, and he also has, lay still, you're doing all right. You want me to wait? Let's give some more num-num. He also has facet joint pain and sacroiliac joint pain is what we believe. Lay still.
Okay, hold on. Okay, you're doing fine.
All right. Well, I have no doubt the discogram will be an interesting process. I just gave him a little more numbing medicine. He's got a lot of it now. And I'm going to go ahead and proceed. We'll make him a little bit more comfortable. Okay. So once again, he's had a microdiscectomy shot. And he has pain now coming from several places, the discs as well as his facet joints and SI joint. And he has a very narrow spine. So I'm going to have to find the right entry point. Shot. Shot. Let's get an AP. We're going to use the X-ray machine to identify the target as well as navigate to the target. We call it localization and navigation. All right, very good. So I'm a little bit medial. I'm going to come a little bit more lateral then. Shot. Perfect. That is much better. All right. Whoop. Go. All right. He seems to be rotated a little bit, I think on orbit. Let's go ahead and fix that. Shot. It looks worse to me. Let's go back. It's important you have your fluoroscope lined up properly with the patient's spine before you go too far. So I'm looking at the back of the vertebral body. That looks better to me, Jordan. You can also look at things like the sacrum or the iliac wings. But you can be tricked too because there's scoliosis. It looks good on orbit, and I think WAG is acceptable. You're off by about half a degree on WAG. But I think it's good. I'm happy with that. All right. So I'm scraping along his facet joint, shot. And we're heading to the disc, the first disc, L5-S1. Shot. Let's get an AP. Hold on. I'm not really entirely happy with our position. So let's see where we are. That looks pretty good there. We're right at the mid-pedicular line. All right, we're off on WAG there. Let's try to get the end plates lined up. Actually, your you're pretty good on the orbit. You can see the iliac is lined up better. I think you're off on WAG just a little bit. Other way. Once again, it's important if you're doing these types of surgeries to get the fluoroscope lined up perfectly. As perfectly as possible. Shot. This is where he had his surgery, by the way, so I'm hitting some scar tissue here. You felt it, yeah, with your eyes, right? I felt it too. There's a lot of, yeah, there's a lot of scar tissue there. We're making our incision. We'll now place our second needle for the L4-5, since he has 2 herniations that we're going to be fixing. Shot.
So I have a question about.
Hold on a second. Let me just focus for a second. Sorry. He's a little bit more challenging than I thought he would be, just because of his anatomy, his spine being so narrow. So just give me a second and I'll take your question. I think this is looking good. AP? Yes.
So the ergonomics of spine disease.
Uh-huh.
Does flexion jobs where they're flexing a lot for work, repetitive flexion of the spine,
Repetitive
does it
flexion.
trigger to more problems with facet joints or disc disease?
Great question. I think jobs that do a lot of flexion could be hurting your facets or your discs. Yeah.
Because he mentioned it's a very repetitive job.
Yeah.
That's the thing.
And the other thing you have to think about is, remember, it takes a traumatic event to hurt either one. We're ready for him to wake up. So you need to have trauma first that rips the capsule of the facet or rips the annulus. Right. The annulus is the capsule of the disc. The capsule of the facet holds the bones together. So you got to rip that first from trauma. Then the repetitive bending is going to squeeze pieces of herniation out through the tear in the back. So
Your mechanics are altered and then your facet joints will become problematic.
exactly. That's exactly what happened. As your disc collapses, it changes your biomechanics of that segment.
Right. Okay, my friend, how are you? You okay? Good morning. How are you? Can you open your eyes for me? We're going to ask you some questions now, okay? Make sure that's all good.
If he needs more time, let me know. I can do his.
Put him a little deeper when he was.
Do you want me to do his facets real quick? All right, let's just go to an AP view. We're going to treat the facet joints while we're waiting for him to wake up. So we use our time as productively as possible. The facet joint treatments are done with the Deuk plasma rhizotomy. Shot. Shot. Now show us our target there, Jordan, so our viewers can see the target. Shot. That's right. That's where I'm headed, folks. Wow. His spine is really deep. Deeper than I expected it to be. So it's deep and narrow. Hold on. Shot. Let me just make 100% sure. Right there. Shot. He's waking up.
Yeah.
Shot. All right. Num num. We're going to get him a little more awake so we can do our discogram. And then.
Okay, my friend, keep your head down. Can you open your eyes for me? Okay, good. Can you
All
put
right.
your head
Well,
down
we're
and
just going to
ask me a
wait then.
question? Head down for me. Head down. Thank you. He's following commands.
Good. All right. Well, we're going to go back then to the discogram. Are you awake?
How are you doing? Yes, put your head down.
Yeah, lay down, don't move. We just need you to answer us. We're going to put you to sleep soon.
You're doing great. Just keep your arms still here.
If you have any pain, I want you to tell me how bad it is, scale of 1 to 10. Okay? How bad is that pain, scale of 1 to 10?
What number?
What's the highest?
12, he said.
12. Is that where you get your pain?
Yes.
Okay, okay. I'm sorry, we had to test it. So L5-S1 is a 12 over 10.
Okay.
Should be better now. Yeah, he definitely had a positive discogram there. All right.
Keep your head still for me, okay? Good.
You're doing great. Everything is okay.
Doing well.
How bad is that on a scale of 1 to 10?
Give me a number.
How high?
He said a 10.
10. All right, we're going to put you to sleep. Is that where you get your pain? All right. I'm sorry. I'm sorry.
Yes.
So, folks, we just did the ultimate test to see if a disc that's injured disc is causing pain for a patient, and the answer is yes. So, Sanjay, let's go ahead. Lay still. Sanjay, let's go ahead and show the audience why does a disc herniation hurt so bad. Welcome back. Our patient is going off to sleep, and I am taking out the spinal needle. I'm leaving the guide wire. The guide wire will guide my dilator. For those of you who don't know, move your hand please. Do you see this here, Sanjay?
Yes, I do.
The dilator doesn't cut anything, it just spreads the muscle fibers. So we're going to pass through muscle now. As we do that, we want to spread the fibers open. And I'm going to be injecting some Novocaine or numbing medicine as I go down. Shot? There are certain structures under the skin that are sensitive to pain. The skin itself is, the fascia, the muscles. The bone or periosteum is, but we're not going through the bone. The disc is, and we're going through the disc. As a matter of fact, the most painful structure is the disc, the herniation. We're going to be passing right through the disc herniation and the annular tear so that we can actually operate on that. He's doing great. All right, we're in the first painful disc, L4-5. This was a 10 over 10 pain when we tested it, 10 over 10. Now we're placing the tube over the dilator. And it went in very easily, which tells me that his tear in the back of the disc is very big annular tear. You could see it on the x-ray as well. His tears are huge. They need to be fixed. These tears, folks, the annular tears where the herniation comes from, they do not heal themselves. They cannot heal because they have the herniation which is stuck inside the tear. Therefore, they have to have some help. And that's what the Deuk laser disc repair is. It's help. Help for your body to heal the tear and herniation on its own. Okay? It's the only surgery in the world that helps. Look at the tear. Hey, Sanjay, that's a really nice picture of a tear. Annular tear. Let's keep that.
Yes, Dr. Deuk.
You can see the dye leaking out through the tear. Let's get that picture for annular tear.
Yes, Dr. Deuk.
And I'll get it again. Are you ready?
Yes, I'm gonna take that.
All right. Laser. So this is what the laser does. It cleans the annular tear. Any questions from the audience?
We have a question from Janice on YouTube.
Okay.
Have you ever been able to get Anthem Blue Cross to pay for the DLDR?
Have we ever been able to get Anthem Blue Cross to pay for the DLDR? Yes, we have.
I am about taking a job just for the insurance so I can have the DLDR done.
Yeah, so we have had Anthem Blue Cross pay for the DLDR. We've also had Anthem Blue Cross deny paying for the DLDR. And we've had far more denials than we've had payments. And we are having to fight them by writing letters called appeals. You get 2 appeals usually. We do the appeals for the patients. We send in a lot of documentation. We never guarantee that an insurance company will pay for their surgery. Even if we have a contract, we don't guarantee. Because insurance companies play dirty games where they don't pay. They'll tell you they'll pay and then they don't pay. So all of our patients that we do surgery on today in 2023, we have to collect some money up front to help cover our costs. And we bill the insurance. If the insurance doesn't pay, we fight them. If they pay, wonderful. We've had Anthem pay before, but it's not common. It's far more common not to pay, and we have to fight them. Fighting the insurance company can take years to get paid, years. And we cannot, we have to literally spend resources, billing people's time, resources to try to get paid. Remember, payment for surgery is the patient's responsibility, not the insurance company. It's the insurance company has a contract with the patient to pay for their medical services. It's the patient's responsibility to get the insurance company to pay. As a matter of fact, there was a recent news article of a lawyer who had to have cancer treatment, and Blue Cross Anthem denied the payment. They would not pay for it. So he paid $100,000 out of his pocket for the treatment. He then sued the insurance company and won. So that is unfortunately what has to happen many times. People have to sue their insurance company to get the insurance company to pay for their medical care. It's tragic. But it's that way because people allow it to happen because they do not hold the insurance company accountable.
Well, they don't know how to.
Well, they have to learn how. Because I had to learn how to hold them accountable. I was told, oh, go be a doctor, do the medical care, do the surgery, you'll get paid. You know, you have a contract, you'll get paid. That's not true. It's a lie. They don't pay. They lie. They say we lost the claim. Oh, you spelled the patient's name wrong. Oh, you put the wrong social security number. Oh, we don't know where the claim is. It never came in the mail. So we have to do all these things to try to get paid properly. And the people who get the service have no idea how much time and effort doctors have to spend trying to get paid. And they don't care. As long as it's not their problem, they don't care. Well, we make it your problem. We cannot afford to do these surgeries, which are very expensive surgeries, for free. I cannot afford to pay for them. So the patient has to pay or their insurance has to pay. It's that simple. And so if your insurance won't pay, that's your fault for not having good insurance to pay. We will help you get it paid if it can be paid. We'll do our best to fight. But in the end, it is your insurance. You're responsible for it, period. Yeah, it's hard enough finding the cure to back pain. Then you want me to have the cure to health insurance company, the most powerful business on earth. They run the United States government. They control everything. And they have one goal: profit. And the way you make profits in medicine is by not paying for people's surgery or their medical care. Everyone has seen denials before. Whether the insurance company denies an MRI, an X-ray, a CT scan, I've seen denials left and right. They don't want to pay for the newest medication for diabetes, so they deny it. You pick it, they do it. The insurance companies are all about one thing: denying treatment, not paying for treatment so that they can make more profits. So I can't fix that. It's a broken system. All I can do is fix people's backs and necks. The rest, the people have to fix. I'll make you aware of the problem, but in the end, we'll help you. We'll stand by your side. We'll help you. We'll submit the things for billing to the insurance company. We'll get the form signed. We'll even hire a lawyer to fight them for you, the best that we can find. But in the end, people have to take responsibility for their insurance. I myself had sinus surgery done, 4 months ago now? The insurance company refused my surgery. They denied it. And I had to pay out of pocket, okay? And so I paid thousands of dollars out of pocket. And then fought my insurance company, and they paid eventually. So that's just, unfortunately, the situation we deal with today is with insurance companies. It's not my fault, but people have let the insurance companies get away with robbery for too long. And now, you know, it's kind of like having a drug dealer in your neighborhood. If you let the drug dealer get established, they're going to sell drugs to all the kids, okay? They just want the money. They don't care about the safety of the children. So if you allow a drug dealer to get set up in your neighborhood, don't blame me for coming around your neighborhood and say, oh, it's your fault that there's a drug dealer here. No, there's not. It's your fault there's a drug dealer. You allowed the insurance companies to do what they do. And by the way, the reason the insurance companies get away with not paying is because the state laws allow them. Every state is different. Some states are more pro-patients and some states are much more pro-insurance companies. I'm sure you've all heard about people who have insurance claims that don't get paid. They get denied. It's called a denial. Insurance companies in every state have to deal with the state laws. And the politicians that write the laws, if they're working for the insurance companies, then they're going to write laws that let the insurance companies deny claims. If the politicians are working for the people, then they're going to write laws that protect the people from the insurance companies not paying their claims. So Florida is a horrible state where the politicians basically are being bribed and paid off over the years by the insurance companies to write laws that let the insurance companies not pay medical bills. And that's why a lot of hospitals are going out of business. Same thing in Texas.
But it's the whole insurance industry. I know
It's the whole insurance industry. Yeah, whether it's flood, homeowners, the insurance companies sell you a policy, you give you the sense of security that you're going to have you're going to have financial coverage when you need it, and then when you actually need it, they don't. So we've posted on our Deuk Spine Institute Facebook page a recent trial by a lawyer who, I told you, had to pay $96,000 for his cancer treatment, which Blue Cross denied. I think it was Anthem. Could have been Blue Cross, but it's the same company, basically. They denied payment. He paid it. He fought them in court. Took 3 years, and eventually they paid him. Okay? That's what people need to do. They need to fight for their health care.
I wrote a letter to the governor.
You wrote a letter to the governor?
I didn't get a response.
Huh. You didn't get a response? What was yours? Because they wouldn't pay you for your health care?
No. I wrote a letter regarding flood insurance and
Oh, flood insurance.
wind mitigation.
Yeah.
I wrote a letter about that because I felt the actuaries in the state of Florida should use historical data when they do the flood zone mapping. So when I went to buy my house, I couldn't buy it because it was in a flood zone.
I see.
And I checked
You couldn't get insurance for it.
so I couldn't afford the house.
I understand.
So the
I'm
historical
sorry to hear
data
that.
said it never had a flood in the 20 years that it was there. So I asked, can you use the historical data to...
Shot?
They said that's not applicable. So I couldn't buy it. But I like the house. Then I bought a
Shot?
But anyway, that was just why I wrote the letter.
All right. Well, insurance companies are getting away with highway robbery, and the people that are suffering are the actual people paying, the taxpayers, the actual citizens. And it needs to be fixed, and I can't fix it. I can only help. But in the end, people need to fix it. Hold on. Shot? Yeah, we're in. It's just a big tear. Shot? All right. All right, any other questions?
We have a comment from Janet on Facebook.
Sure.
It's on the insurance side.
It's on the what?
It's on the insurance.
Oh, okay, sure.
Even when you get a hearing through the Center of Medicare and Medicaid, and they say they have to pay, they can't make them pay.
Yeah, that's right.
Then why do they exist?
Why does what exist? Laser. Why does the hearing exist?
Yeah.
I don't know. You're asking a good question. You
I
have to understand the system is rigged. It's rigged in favor of the insurance companies to not pay their bills. I can't answer all those questions. I don't know the answers, all of them. Go ahead.
I fought for a year to get payment, writing email after email, until they finally paid what they were told they had to pay.
Yeah. Well, I'm glad they finally paid for you. Yeah, there are some people who find success, with Medicare. We tell all of the patients with Medicare that we do not expect Medicare to pay for this surgery. There's lots of things Medicare will not pay for. Medicare will not pay for artificial disc surgery. Many people don't know that. Medicare refuses to pay for artificial discs in the spine. Medicare doesn't pay for a lot of treatments. As a matter of fact, I personally think the whole Medicare system is corrupt. I think that the payments that they agree to pay for things, you have to bribe the politicians. You have to bribe the right people. And ultimately, Medicare is controlled by private insurance companies, okay? For example, in Florida, the Medicare administrator is called First Coast Services. First Coast Services is a subsidiary of Blue Cross Blue Shield. So it's basically Blue Cross, Cigna, United Healthcare, Aetna, Humana that run Medicare around our country. They run Medicare's benefits. They're in charge of deciding what to pay for, what not to pay for. And what I've seen over the years, since they took the power away from our government and the insurance companies are now deciding what to pay for, I've seen the Medicare benefits go down every year. Worse and worse and worse. Less and less and less is paid for. So for me, these insurance companies are stealing everyone blind. We just posted an article at Deuk Spine on our Facebook page about how somebody is suing the Medicare Advantage plans. I think it's either the hospitals are suing them. I think it's the hospitals are suing the Medicare Advantage plans. That's the Blue Cross, the Cigna, the United, the Aetna. They're suing those insurance companies' subsidiaries that do the Medicare Advantage for not paying for the bills, not paying for medically necessary care. So we're going to see a lot more lawsuits because what's happened over the years is the insurance companies have written laws that let them get out of paying for these services, and it's gotten so bad that finally the providers are waking up to the problem and dealing with it. And you're going to see more and more lawsuits in the future against the insurance companies. Someone needs to hold them accountable for their evil. They're supposed to pay for medical care, not deny it. They're supposed to pay for people's medical care, not make profits, ridiculous amounts of profits, which they do. There's no regulation, by the way, of the insurance companies. Okay? United Healthcare, for example, they bring in, I think it's $100 billion every 3 months. They bring in around $400 billion a year. I guarantee you they do not spend $400 billion And that's what they say they bring in. I'm sure they bring in even more. We don't know about it. But they have all kinds of tricks to steal money from people for themselves and not report it, by the way, as taxes, and not report it to their shareholders. And the way they do it is they use subsidiaries. The United Healthcare pays to the shareholders money, premium, whatever you call it, but they do not, they have subsidiaries that they pay vast amounts of money to, that those subsidiaries could be privately held, and people making gazillions of dollars on the subsidiary services to United Healthcare, for example. They have ways of hiding the money, and it's far more complicated than any of us could understand. I know I can't understand it all. And our government certainly can't understand it. Since they're controlling the government's not going to go after them. So you need the people who are being deprived, which is the patients and the providers. They're being deprived of payment, services. We need those people to go after them. Deuk Spine is going after the insurances, but we're on a very small scale. Very small. We only have a few claims. We're a small company. We're not a big hospital system. But thank you for sharing your story. It's one of courage, and I love it. When people fight for what they know is right for themselves, especially when it comes to health, you have to fight. Nobody else will fight for you. Doctors are clueless as to what to do. They just try to avoid the whole situation. At Deuk Spine, we're doing our very best to help people get the care they need. We offer huge discounts on our deposits for our surgeries. People, if the surgery is $100,000, we don't ask people for $100,000 up front. We ask them for a small amount, and we bill their insurance the rest. And yes, spine surgery is expensive, people. Get used to it. It's not our fault that it's expensive. It's the whole industry of healthcare that makes it expensive. All the regulation, all the costs. I don't want to go into all the details right now, but it is vastly expensive to run a surgery center or a hospital. And I think we do a damn good job of keeping the costs down. But inevitably, we're stuck. And there's a lot of greed in healthcare, I could tell you that. A lot of companies that provide supplies that are greedy, that raise the cost dramatically. We're just about done with the L4-S1. So we've already done the L4-5. We're now doing the L4-S1. And he's doing fantastic. He really has a low pain threshold. Any more questions?
No questions.
All right. So do we have we shown the video on why that's a herniation right there. You guys see that? It just popped out?
Yes.
Look at the inflammation on it. See the red stuff?
Yes.
That's what we talk about all the time at Deuk Spine. This is what we're here to remove, the inflamed herniations. Beautiful. Thank you. Did it fall? Almost done. Too big to come out, huh? I'm going to need the laser one more time. And then we're going to go to the DPR, correct, Luis? So that is a piece of herniation right there. And guess what? It's stuck within the annular tear. And you can see the grabbers just don't work. They don't work. They can pull out a little bit, but the main herniation's still there. This is why you need the laser. The laser is the only tool in the world that can remove this. And you got to do it visually with the endoscope. So there's nothing else that works and fits down the endoscope. He's going to feel so much better, I'm sure. Well, Jordan, will you let Patel know that we need to write SI on him tomorrow? DPR. I can't do it today. I have a feeling we're going to need to do an SI DPR. pretty much done here. Let me just check. Let's get the grabber in one more time. Any more questions?
No questions.
And we've done the 2 videos, right? The 2 educational videos.
No, we're just done with one.
Let's do the second one. How does the Deuk laser disc repair actually eliminate pain? Yeah. All right. Welcome back. You could see with that nice video there what the Deuk laser disc repair, what we actually do is go in and clean the tear in the annulus, get rid of the herniation in there, the granulation tissue, the inflammatory tissue, and that allows the disc to heal naturally. By cleaning the tear, we are removing the source of pain, which is the annular tear. All right, we're going to move on from the Deuk laser disc repair, fixing the 2 very painful discs that he had. We're going to move over to the facet joints. We put some numbing medicine a while ago, but it's probably gone, right, Berndes? Yeah, we'll give a little more. Yeah, I'm going to put some more right now. Shot? All right. Yeah. So let's do some num-num. All right.
We have a comment from Mahesh Dalvi on YouTube.
Sure.
He says that he likes the fact that we do live streams of the procedures, and that makes it much more transparent for the public outside.
Oh, good. Thank you, Mesh.
He also wishes that we could take the
Nice.
patent of this and make other doctors capable to serve people from other parts of the world.
Shot? Yes, we agree, Mesh. We want other doctors doing this surgery. Though, I have to be honest with you, Mesh, I think there's a problem when you start doing these types of surgeries all around the world. What we lose is we lose what's called quality control. And quality control is very important. Okay, what I mean by that is some other doctor somewhere may end up choosing a cheap endoscope or a cheap fluoroscope or a cheap whatever because it's less money. And the patient will suffer and the results will not be as good. So I think what you're going to see, my friend, I assume you're from India. I could be wrong, but let's say you're from India, right? If you want to see the Taj Mahal, you go to India. People are going to have to travel. If you want to see Mickey Mouse, you go to Disneyland. Okay? If you want your spine fixed, travel. Why not? It's called medical tourism. People are doing it now. And Thailand, yeah, we had a guy from Ireland. He came just Tuesday. Sean?
He's doing great.
He's doing amazing. He's very happy. My point is, if people are willing to travel for vacation, why not travel for the best spine care in the world? Okay? The problem is if I teach other doctors and they do it wrong, or they cut corners, they try to save money, you know, then they're going to hurt people, and we're going to have bad results. And it's not worth it to me. Okay? And that's something that I've learned over the years. Quality control, very important. That's why I only hire the best doctors here at Deuk Spine. We only have the very best. Okay, not all doctors are equal. They're just not. Not all dentists are equal. Not all soccer players. Hey, not all cricket players are equal. That's something you might be able to relate to. So, just about done, 30 seconds. Yeah, so it's important that people have the best care possible. And, you know, this is not just some simple making a ice cream sandwich kind of thing. This is very complicated surgery. I just make it look easy. So yes, we are going to train more doctors, 100%. But those doctors will work under my supervision and direction. Okay, I will make sure that we use the very best ingredients for every patient so that no patient has a surgery procedure that's worse because they went somewhere else. I want them all to have the best. After all, it's my name on that procedure. So it has to be, in my opinion, has to be done properly. If you're going to put your name as the inventor, you have to make sure that the quality is the best quality. Shot? All right, we're just about done. 10 more seconds, we're done. And I'll come answer questions. But this is the DPR at L4-5, L5-S1. We've already done the DLDR. It went perfect. Type up your questions for me, and I'll come answer them. Great job, everybody. Thank you. Huh? Scope use was 4. Our next patient's from Los Angeles. And they're having a cervical DPR, Deuk plasma horizontomy for facet pain, and they're getting an ischial tuberosity injection, right? We need to have, Frances Cheney's out. She's at the AAPM on our meeting. Yeah. All right, Sanjay, you can go ahead and cut to a testimonial, and I'll come answer questions. Good morning, I'm Dr. Deuk at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day, and I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that to me is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional, because it is an emotional thing. When you've been burdened with this pain for so long, and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm 1/4" incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are, pain-free for the first time in many years.
Many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Deuk, and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions, and that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All right,
life.
thank you.
All right, I hope you enjoyed the testimonial as well as the surgeries. And move the chair out of the way. Sanjay, my friend, you got to work on your camera skills here. All right. Sorry about that, folks. Well, that should be better. All right, nice to see everyone this morning. We have just completed fixing a patient who traveled to us from Texas. He's actually a chef, and he's been unable to work for several years because his back has been killing him. He's had surgery done elsewhere, the microdiscectomy. It did not work, made him worse. His pain turns out to be coming from 2 discs in the bottom of his spine. We just confirmed that with the surgery. The top disc is the L4-S1. He had a tear on the right side. That disc was 10/10 pain. He had horrible pain, 10 out of 10 when we tested it. It's typical pain. The bottom disc, L4-S1, had 12 out of 10 pain. So when I tested that disc, it was severely painful. His pain is really localized to the bottom area, L4-S1, L4-S1. He may have some sacroiliac joint pain, hard to say, but he does have pain in that area. We may have to do an injection of the SI joint to see if that's going to help him. But he also had facet joint pain here, and we treated the facet joints with the Deuk plasma rhizotomy, L4-S1, L4-S1. The surgery was done endoscopically. We use a small tube. We come from the side, and we basically enter into the herniation from the side. We don't go the traditional route of going through the middle of the back because you have to drill bones and ligaments away. That's what all the spine surgeons are taught to do. Come from the back and drill bones and ligaments away. Our approach is from the side. It was developed by an Iranian orthopedic surgeon, Dr. Parviz Kambin, in the 80s in Pittsburgh. So this patient could appreciate that. He is also Iranian. We'll take some questions. The surgery went well. I am a little concerned. We may have some sacroiliac joint pain to deal with at the end of the surgery. We'll see how he wakes up. We'll see by tomorrow he'll be able to tell me if he still has pain in that area of the SI joint. And the reason I know that is because I mapped his pain out before surgery, and he had some pain that was over to the side where the SI joint is. So we may have to do a rhizotomy or possibly an injection. We'll just see.
The first question comes from WD on YouTube.
WD, welcome from YouTube.
How would I approach the insurance company before starting the process?
How do I approach the insurance company before starting the process? So what we do at Deuk Spine for everybody that has insurance is we look at your insurance at the time that we figure out what you need done. And if you need done something that is covered by insurance and we know they're going to pay, then we'll tell you that up front. If you have something that needs to be done, like the laser surgery, that we don't know if your insurance will pay, we'll tell you that up front. If we know your insurance will not pay for the surgery, we'll tell you that up front. So for example, Medicare will not pay for the surgery, the laser surgery. We're going to tell you if you have Medicare or a Medicare Advantage plan, it's not going to pay. You need to pay out of your pocket. Is it worth it? Absolutely, it's worth it. It's always worth paying for medical care that's high quality, that's going to give you great results, rather than living in pain or undergoing treatments elsewhere that's covered by your insurance that won't fix you. That's always, when it comes to fixing your spine, get it fixed right. There's no doubt in my mind that every penny you spend getting a good surgery like the Deuk laser disc repair done for you is going to pay you huge dividends in terms of quality of life. The problem most people have is they think, oh, Dr. Deuk says Deuk laser disc repair, I got to pay $25,000. Or I can go get a laminectomy by Dr. Schmoozy Bum Bum, who has Medicare that will pay for it. The laminectomy will not fix your problem. The laminectomy has a much higher chance of complications, like spinal fluid leak, okay? I'm going to show you a procedure that Medicare pays for. Medicare paid for this man's surgery, okay? He's now on our website begging us to help him because he had what's called a laminectomy done and a fusion. Laminectomy and fusion should be covered by your insurance. This is what he's dealing with right now. Okay? Basically, an infection on his back. Can you guys see that? That's his butt crack there, and that's the wound opened up, and he has spinal fluid leaking out because his surgeon screwed up the surgery and damaged his nerves and his dura. That's what we're trying to keep you from having done. It's not just we want your money, we want to help you get out of pain. It's that everybody else out there is doing bad surgery that's going to fuck you up, and you're going to have to pay the price for it. That infection right there that you just saw on that patient, it's never going to go away. It's never going to go away because he has a spinal fluid leak. The way you make an infection like that go away is you put him on antibiotics, you do surgery, you debride it, and then you put something called a vac dressing on there. It literally sucks the juices out of the wound and it lets the wound heal. You can't do that when somebody has a spinal fluid leak because you're just going to keep sucking spinal fluid out and that's going to make them die. So what are we really trying to do at Deuk Spine? Keep people from having very bad outcomes from their surgeries that don't work. That's what we're doing. So as far as the insurance question goes, getting back to it, you will never know if your insurance will pay for the surgery before surgery. The only way we know is after. Insurance companies don't pay for surgery before surgery. They pay for surgery after surgery. The insurance company will tell you, we'll pay, and then they won't pay. And they'll come up with any number of 100 excuses why they don't pay. Your insurance company will tell you, we won't pay, and then we'll get them to pay. It's just impossible to predict who we're going to get to pay and who we're not going to get to pay when it comes to commercial insurances. Now, when it comes to Medicare, we'll tell you they're not going to pay. VA, not going to pay. Medicaid, not going to pay. So there you have it. There's the insurance summary. You can do all the legwork you want. In the end, we're going to tell you you're going to have to pay X dollars before your surgery out of pocket to help cover some of the costs of the surgery because we don't know if your insurance is going to pay. We know if they're not going to pay. You have Medicare, Medicaid, VA. We don't know if they will pay. Even if they say they'll pay, they may not. Even if they say they won't, they may. So it's totally unpredictable. So go ahead and waste all the time you want with your insurance company. Don't listen to us. But if you're not going to listen to us, don't bother coming here either. We're not interested in taking care of patients who don't follow instructions.
The next question is from And Justice for All on YouTube.
Hello, and Justice for All. Good to hear
morning,
from
Dr.
you.
Deuk. Good morning, Dr. Deuk.
Good morning.
What do you think about endoscopic laser surgeries performed in Germany? I am from Europe, and around here, Germany is famous with its endoscopic spine surgeries.
Yeah, Germany endoscopic laser spine surgery. I wouldn't do it. Again, I wouldn't trust anybody else but the best, the company that founded the procedure. That's all I can say. I don't think people are really understanding the point here. This is not about the procedure. It's about the surgeon and the company doing the procedure. You understand what I'm saying? Let me ask you a question. I'll sell you a car. It's used. Will you buy it for $3,000? Think about that. Don't you want to know what you're getting first? You're going to want to know the make of the car, the model. You're going to want to see pictures of it. Why don't you have the same standard for your surgeon? Why would you just say endoscopic laser surgery, Germany, and go do it? You don't think Germans have bad outcomes for their surgery? They do. They do. By the way, I'm part German. So, of course, Germans have bad outcomes. What you're trying to avoid, people, is you want a good outcome where you actually get elimination of your pain and symptoms, but you're also trying to avoid a bad outcome. And when you go to say, oh, let's go to a German surgeon that does endoscopic laser surgery, you have no idea what their outcomes are. At Deuk Spine, we show you our surgeries, every single one of them. You see the surgery being done. We have hundreds of patients doing testimonials. Show me the same results in Germany. Show me they do the surgery exactly the same way I do it, and then I would consider telling you, go for it. But without actually witnessing what they do and their results, I would not recommend it.
The last comment from Janet on Facebook. All spine surgeons should be like you.
Oh, thank you,
Instead
Janet.
of letting greed control them, they're supposed to do what is best for the patients.
Janet, I love your comment, and I agree with you. And there are, in the United States, about 7,000 spine surgeons, okay? And that's counting the ones that are real spine surgeons. There's lots of pain management doctors who call themselves spine surgeons that are not. And by the way, they're doing spine surgery, and they shouldn't be. Those people are dangerous. But then again, spine surgeons are dangerous too. When we talk about spine surgeons, there's two types. There's neurosurgeons that do spine surgery, and there's orthopedic surgeons that are fellowship trained to do spine surgery. Those are the two real types of spine surgeons in America that you should consider spine surgeons. Orthopedic fellowship trained spine surgeon, neurosurgeons. Then there's the pain management doctors, and they vastly outnumber the real spine surgeons. But they're out there trying to make money, and they're greedy, and they're doing spine surgery when they should not be. Okay? That's number one. Now let's talk about the real spine surgeons for a moment. I agree with you. They should all be doing what's best for the patient, which they're not. They are not doing what's best for the patient. The problem is, why are they not doing what's best for the patient? You have to ask yourself, is it because they don't know how to do what you're doing? The answer is yes, 99.999% of the time. They don't know how to do what we're doing. They don't, all right? But do they know about it? Yes, they should know about it. And could they learn, just like I did, can they go out and learn from experts how to do endoscopic spine surgery? The answer is yes, they can. So why are they not? That's the real problem, is maybe they don't know how to do it in their defense, but they know that it exists. There are peer-reviewed published articles. I've presented it at major meetings, the neurosurgery meetings around the world. They should know about it. They should learn to do it. Okay, doctors have a responsibility, in my mind, to always be able to keep up to date on what is the best treatments in the world for their patients and offer their patients those treatments. And if they can't do it, they should send the patient to someone who can. It's called a referral. Doctors should be referring their patients to doctors that can do the best treatment for their patient. For example, I'm a neurosurgeon. I was trained to do brain surgery. Okay? If I see a patient that has an aneurysm in the brain, I look at that patient, I could say, all right, I could do the aneurysm surgery, and I'm a very good neurosurgeon, but I'm not the best. And I don't have the latest catheters to coil the aneurysm. I don't have the ICU training for the nurses and staff to manage vasospasm or hemorrhaging that could occur afterwards and kill the patient. So what I say as a good doctor is, you know what? I know how to clip an aneurysm. I know how to treat that. But you know what? I'm not going to do that because I'm not the best choice for the patient. Instead, I'm going to send that patient to where I think is the very best for them. And that's what I do. I do referrals all the time. I acknowledge the fact that I am not the best at all these other areas of neurosurgery that I've been trained on. I'm not the best, and I want my patients that come see me to get the best. That is what doctors should be doing, but that's not what's happening. And that's where you're correct. The greed is causing them to want to do all these treatments that don't work, that can harm the patients, and that's what's happening, okay? And that's why I do the broadcast. I do these broadcasts not just to make people aware, hey, look at this endoscopic laser surgery that's available now, that's amazing, it fixes people's back and neck problems, but I also do these broadcasts to make people aware that there's a lot of bad surgeries being done by doctors out there that are hurting people, hurting patients. And people are generally not aware of that. Everybody seems to think that it doesn't matter where I go for my treatment, all these spine surgeons are the same, they all do the same thing. Well, we don't. And even if we did the same surgery, fusion, you know, you'll never see any of my patients with this, okay? With their backs filleted open and spinal fluid leaking out of it. This is horrendous. This should never happen, okay? That's because of incompetence of the surgeon, accidentally cutting something that should not have been cut, right? If you're a surgeon and you're a good surgeon, you should know where are the nerves, where is the dura, you know, if there is a spinal fluid leak already there, I have to avoid it. So it's the responsibility of the surgeon to do the surgery properly and avoid those type of complications, okay? The problem is when they have a complication like that, they're going to say to the patient some BS story, like, oh, you know, there was too much bone in there and we had bone cut through the dura. I hear it all the time. I ask people with complications, what did the surgeon say to you? What did they tell you happened in there? And they said, oh, they said it was really tight and that the dura covering was already cut and that they just found it. I'm like, fuck no, that doesn't happen. That's bullshit. There's no such thing. They're lying to the patients to cover up their mistakes. And that's why I do these broadcasts, folks. I want you to be aware there's a lot of bad surgeons out there. And if you just go anywhere, Germany for laser surgery, you may be putting yourself in harm's way. So at Deuk Spine, we don't have these complications. Our complication rate is less than 1 in 1,000 surgeries. It's extremely low. Why? Because we are the very best at fixing spines. Technically, we have the best equipment, the best staff, the best procedures, the best diagnostics, best medication. We have the best of everything. And it shows in our results. Any more questions?
That's all.
Have a great day. We'll be back. The next patient is having cervical Deuk plasmarizotomy for facet pain in her neck, and she's having an ischial tuberosity tendonitis injection for hamstring pain at the ischial tuberosity. We're doing that in another room that doesn't have a camera. You won't see it. It'll be a quick surgery. Then we'll be back again for another Deuk laser disc repair. So take a break, enjoy your lunch, and we'll see you in about an hour,